Hello, and thanks so much for joining us today. I'm Carol Jenkins. The program is Black America, and you can tell that we're not in our usual CUNY TV studio today because of the pandemic. So I welcome you to my home office. And we are thrilled today to have as our guest Mikki Kendall. She's a Chicago-based writer, activist, feminist, and she's got a new book out called Hood Feminism, Notes from the Women That a Movement Forgotten. Mikki, thanks so much for being with us today.
Thank you for having me on.
Yeah, I'm a big fan of your thinking and your writing, so I'm thrilled to have you. I want to start somewhat off of the book, but I definitely want to talk about feminism and your take on all of that because it's fascinating. But you're in Chicago, and you grew up there. You're formed by Chicago. I was just looking at some of the statistics of the COVID-19 effects of the Black population. And there where you are in Chicago, even though Blacks are only 15%, or in Illinois, 15% of the population, they're 42% of those who died during this pandemic so far. Can you, and I know you have thoughts on why this is, so if you could share that with us.
So I'm going to roll the clock back pre-pandemic, okay?
Right.
Illinois has always been, of the Midwest, slightly better than some other places, but not meaningfully better to be Black in. And that's because between poor healthcare, I don't know if anyone remembers Rahm Emanuel. Look, I even said his name without swearing, but he closed a bunch of health clinics. So in a system where your employment dictates your access to healthcare, when you close free health clinics, you shut a significant portion of the population out from ongoing preventive care, okay?
Right.
Then you add in environmental racism. One of the things that had been a big scandal in Flint was lead in the water. Well, the quieter scandal was happening in Chicago, where technically our water supply is not the problem. It's the lines leading into homes and buildings
Precisely.
that the city then declared they had no responsibility to replace. So you, the individual homeowner or landlord, was required to replace that line. I will let you guess how many people can afford, at the drop of a hat, to dig up a significant portion of the street to run a new water line. So what we're seeing now is the impact of decades of neglect of communities. And I know that even though the Black population is among the hardest hit, I'm going to be honest and say that I think that when the numbers shake out, we're going to find out that, like everything else that goes wrong in Chicago, everyone has gotten hit really hard because access to healthcare has been a problem here for decades. Quality healthcare has been a separate layer of that problem because even if you have insurance, are you seeing a doctor that treats you appropriately? Are you seeing a doctor that follows up and makes sure? I'm very fortunate. I'm a veteran. I can go to VA and I do. So I have ongoing care, but I know from having been seen locally that the quality of care at VA, there's a reason I go to VA. The quality of care I'm getting in that system, even though VA is imperfect, is drastically better than the quality of care I get as a Black woman.
Sure.
I had federal health insurance. I had Blue Cross Blue Shield, a Cadillac plan, the best possible. I still had a doctor tell me with a straight face that all of my problems were associated with my weight. Actually, what was happening was that my thyroid was growing a tumor.
Right.
You know, my VA doctor caught it. I'm fine now.
Right.
But if I had good health insurance and I went someplace great and that's the care I received, I already know that the care you're receiving without that level of health insurance, without the ability to advocate for yourself, without options, is poor. And then we get into things like food deserts in Chicago. One of the things that has been happening, I don't know if people are paying attention because I don't know who's seeing what news outside of Chicago. We see specific grocery stores as being places where employees and patrons are showing up with a heavy rate of COVID-19. The reason that those grocery stores it's happening is not just no one's cleaning or people aren't wearing masks. Those are the only grocery store for a neighborhood or two neighborhoods.
Right. Precisely.
So the number of people who absolutely have no other choice but to go into those stores and to go into them sometimes often, because now we circle around to the part where even if you have a grocery store, can you afford the food in it? And how much food can you afford in it?
Right.
And so we're seeing the cataclysm come together.
Right. So many people, Black people, people of color, on the front lines in every way, in the grocery store, in the public transportation, as well as in the hospitals, doing every kind of work. So, all of those kinds of things are going to lead to higher numbers. But you think they will settle out and people will discover that everybody's been hit? Um,
Well, the reason I think we're going to discover everyone's been hit is only because the people where we're seeing now is the canaries in the coal mine, so to speak.
right.
But the people who are bringing you your groceries, they've been near the people who have COVID-19 who work in the grocery store, or they've had contact with patients or whatever. The people who are doing streets and sand, I mean, even right now, they're doing work outside my house,
Mm-hmm.
right? And the work that they're doing outside, probably not the most necessary thing, but those folks are worried about earning a living. I understand
Sure.
that. A lot of people in Chicago simply can't afford. It's great if you have a job that lets you stay home, but a lot of people are essential workers. A significant part of any city functioning is the nurses, the sanitation workers, the food workers.
Right.
Those folks, not only do they go home, they have to do their own grocery shopping. They have to do their own interacting. And
Right.
I think we're going to see the consequences of that neglect. Are the deaths more likely to happen?
Right.
But how many people don't know they have an underlying health condition or who are going to find out? Do I think don't know they have an underlying health condition or who are going to find out? Do I think the numbers will be even at the end? No, but I think that the numbers in every community are going to seem unbelievably high because we've neglected these parts, this infrastructure for so long.
Yeah, what the pandemic has done is expose the fault lines of race, gender, health. I mean, all of these things that, people who've been paying attention know, that our society is just insanely not in tune to caring for its people. And so what we're discovering is that there is a definite price to pay for that, a big one that you cannot ignore and brush under the, rug and say, oh, well, that's somebody else. I mean, this is, we're living this. The effects of that neglect for years. I want to talk about your book. I was thinking about it as I was reading it, that you were really teaching us lessons about the things that not only feminists, but everybody has to pay attention to. And the very first chapter deals with hunger, which is something that, I always rant and rave about because I've been to some of those food banks and have seen the people who are starving and who cannot feed their children, and many of them, most of them women. As I say, in this pandemic, mostly women will be affected because on every single level they are on the front line of having to feed their children, get health care. So talk to us a little bit about why you think the whole movement of feminism has been remiss in not dealing with the issue of hunger.
So hunger is one of those things that is happening in every community. It's happening at different levels, right? So, okay, fine, in your middle class community or upper middle class suburban community, maybe hunger is not as big of a problem, except we do keep hearing about all those school lunch debts. So maybe hunger is a bigger problem than you realize and you just can't see it. But at base, we've decided that despite it, 51% of the population being women and those women having to take care of children, elders, other family members, that it's their fault if they can't figure out how to make groceries happen on top of rent, on top of. And the reality is that as prices have gone up, wages have not.
Right.
And for people who are facing anything from food allergies to food deserts, I can go and, this whole thing with whether or not you can get your groceries delivered. Well, Instacart is not great, but Peapod pulled completely out of the Midwest months ago and wouldn't deliver to some neighborhoods already, right? Sure. We all complained about the ubiquitous nature of Amazon, but Amazon Fresh in some communities is the only grocery service that exists. And we've made hunger such a thing that if you want to be able to feed yourself on SNAP, which is too low, I think it's something like $1.57 or $1.67 per meal. And even if you're supplementing, where are you going? How much does that food cost? Because I know milk alone, right? I know that milk used to be something like $1.99 a gallon. Milk could be $5 now.
Sure, sure.
Wages didn't jump up enough to make
Now,
up that.
exactly. In fact, one of the things that you see in the food banks is that most people think it's the unemployed. It is the employed, but at such low wage that they still cannot feed their families. They show up in their work uniforms, looking, for a pantry that can help supplement what they're able to provide for their families. Outrageous. And
Well,
I don't
and
know why. I mean, and I don't know why. I so agree with your putting that as the very first chapter in your book. Come on, people. There are families who are starving this country. A friend of mine who's written a book about poverty and children, 1 in 3 children in this country, does not have food security, enough food to eat every single day.
And one of the things about that is that when you look at food insecurity, I know people think if you just stick a grocery store there, right? They sort of sticking Whole Foods in Inglewood here and other places. But
Right.
when you walk in and you look at those prices, and then you do the math on what someone makes an hour, right? Because I want to say our minimum wage, I think it's $8 is the federal minimum wage, something around there, $7.75.
Right.
A lot of people are making $10, $12 an hour. $10 an hour is actually pretty good. I've noticed. How many groceries are you buying for $40 for 4 hours of work? Right. Tie the amount of money you make for a day for $80, let's say for one day's work, but then after taxes, that's more like 65 was what things cost in the grocery store. And you start to realize that when you factor in rent, the health insurance that you may or may not be able to access, medicine to manage the health conditions that you may have figured out you have, you're riding too close to the line. And the place that seems easiest to cut, unfortunately, sometimes is food. People are often, lambasted for soda, for chips, all of those things. You know what those things are? Cheap and shelf stable.
Right.
Fresh produce is expensive.
So I want to get to the feminism part of this, because I think that's fascinating. That these are notes from women who got left behind, the women of color, the women, trans women, a whole host of women who were not perceived to be parts of the first, second, or third even wave of feminism. But I think of us now in that fourth wave, and I see many more women of color, Black women especially, who are the leaders. Do you agree that has happened? That because
I think we're definitely seeing a shift, but it's sort of a gangbuster shift. It's sort of that like, okay, well, you kept saying you would get to these issues later, and now apparently we just have to kind of stage a takeover because we have to deal with these issues now.
Right.
Because one of the things I'm noticing, especially now during the pandemic, is people talking about, I'm home with my kids all day. How am I going to do this? And I think to myself, well, where were your kids before?
Right.
How were the people who were taking care of your kids? How are they doing this?
Right. No, it's a revelatory in every single way. Everything we took for granted as a society has been thrown up. We have to figure out a new way of living. And what I'm hoping, is that this really gets us to change this, the systems that have created this inequality in our society. I want you to talk a little bit about your grandmother and her views. I know that you lived with her for 8 years, and so she was very influential in your life. It's a part of, we always ask our guests, place yourself in Black America.
So my grandmother was a policy woman. I'm realizing I'm not sure if your viewers will understand what that means. But my grandma ran numbers, which is illegal gambling, to supplement her income. It was not that my grandfather didn't work, all of that, but I'm situated heavily on that line between respectable and ratchet, and mostly leaning towards the ratchet part of things. Not that obviously my grandmother taught us to work, to go to school, but my grandmother believed that whatever you had to do to make sure your family was okay was what you had to do, right? And she had that thought process because having been born in the 20s and lived through Jim Crow, she had already seen that respectability didn't get you anything extra. It just got you a suit. It got you a church hat, but it didn't put food on the table.
Right.
And so that's where I'm situated. I'm situated heavily on the South Side in that context. And one of the reasons I keep, bringing these things to feminism specifically, I know people will say, well, these are issues that could go here, 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 is because if they're impacting all of these women and feminism claims to be for women, then feminism needs to address the issues women are facing.
Right.
even if those issues are uncomfortable.
Right. And the things that, so after hunger, there's gun violence. And then I mean, all of these things that are not associated with traditional feminism for sure. And that's the molding, the changing that you think needs to happen in women taking care of their families like your grandmother did. What about hunger? What about gun violence? Do something about it.
Yeah, I absolutely think, especially if we're talking about this as a way for women to support women, we need to look at what those women need. I understand the CEO narrative that feminism has sort of leaned into, this idea that women are leading, things will get better. But then anytime you watch a news story about Theranos or any of these other scandals that have sort of spilled out of women-led companies where the women weren't taking care of other women, you start to realize we never bothered to teach past, you get what you want, and add in, and you have a duty of care to the people below you on this corporate hierarchy. You have to make sure your employees are paid sufficiently. You have to make sure that they have access to healthcare and childcare and all of these things. Because if you're supposed to be the boss, are you a good boss?
Right.
Girl boss sounds great.
Right.
What kind of boss is that girl?
I know. So as we're looking at millions of people thrown to the wolves, so to speak, mostly without support, some lucky people can work from home. Some lucky people, can handle homeschooling their kids. Some, I mean, so it's this really demarcation, the haves and have-nots that shows us so easily and plainly how we have to fix our society.
Yeah, and I think that unfortunately, the lesson is going to be learned the hard way, right? As people are going through this and they're saying, I'm seeing people complain, well, why do people have to go to the park? Well, why are people this? Why are people that? I got into a whole thing this morning about a couple sitting in the park and being harassed by police. And my thing is that if you are living in your nice home with the front yard and the backyard where you can sit out in a chair and get some fresh air and not need to go to a park, great. But a lot of people are living in very small apartments.
Right.
A lot of people are living in spaces with no access to fresh air unless they leave their house and go to the park. Right. And we are now seeing how we didn't create public spaces for people to exist in a pandemic, in a crisis of any kind. We just keep telling people, well, stay home.
Right.
It's home safe.
I know. And with domestic violence numbers skyrocketing, I mean, again, we have another major problem with how women who are trapped in their houses with their abusers, and the children who are abused as well.
Well, and it's what I call it the powder keg, right? Where instead of we didn't give people a way out, a better way to exist. We just said stay home during this crisis, and then we keep adding to the amount of time they're supposed to stay home.
Right.
Well, we know abuse runs in a cycle usually. There's weeks. So maybe week 1 it was fine, week 2, week 3, but now we're hitting week 4.
Right.
And those numbers are going to go up. And unfortunately, some of those numbers are going to be fatal. So we can't just say, well, this is the solution to avoid death without thinking about the other risks people are facing.
Yeah, I mean, you give us so much to think about in your book. So, I get that you think that women need to solve these problems because nobody else seems to be tackling them, and that therefore there's more responsibility. If we call ourselves feminists and, we are supportive of women, that we need to really start thinking about life in general and how to fix our society. Do you think we can actually do this? And do you talk a little bit more? I mean, you're out there, you're talking and very persuasive. So many others, women of color who are rising up to the top now. Are we really in a fourth wave of feminism, or is that what we need? What's your thought?
That we're at the beginning crest of that wave. I don't think we've hit the wave's high point yet. Right. But I think that and the reason I say this to feminism specifically is that feminism has built this massive infrastructure for itself. We have Emily's List and Now and all of these things, and we're gaining power again, right? But what are we using that power for? Right. It's not that I think that men have no responsibility or that I think other non-binary folks have no responsibility. It's that I think that if we're going to act together collectively and say things are for the good of all women in our movement, well, let's use that power wisely. Let's use that power to fix things because, you know, and this is a cliche, but the rising tide lifts all boats. So if all the women can access education, food, healthcare, not only does their health improve and their general personal circumstances improve, their community's health improves. And if your community health improves, then your standard of living improves. And that standard of living means that you reduce things like domestic violence. You reduce things like child abuse and all of that, because we have to create a system that actually takes care of its people. Otherwise, we're left with the same problem over and over again.
Right, right. Well, as we come to the close, and this is, you know, I'm so glad that we were talking with you today to get your take on where we are and where we may be on the other side of this pandemic. But we always ask our guests to finish the statement, the power, the strength of Black America lies. And how do you think about that?
It lies in community. It lies in caring for each other and reaching out and taking care of each other. During a pandemic, absolutely. But even when the pandemic is over, we need to be willing to take care of not just ourselves, but those around us as best as we can. Because otherwise, if we're not working collectively, we're just recycling the same problems. At some point, we have to work on breaking that cycle.
So do you think we'll get there at whenever the end of this is? You know,
I think
the models are saying different things, so we don't know when we'll be out of this. But do you think we can create a better society when we are let out of our homes?
I think we can. It's a question of, you know, this is not, I know everyone's talking like this is the apocalypse. And this is not the apocalypse yet. It never has to become the apocalypse. Right? We're seeing Spain now talk about universal basic income. We're seeing Finland and some other countries that already had robust social safety nets come through this with a minimal amount of death. Absolutely, we are going to lose people. Absolutely, things are going to have to change. We choose how that change happens. Do we come out of this and say, well, I want to go right back to not enough healthcare, not enough food, not enough safety? Or do we come out of this and say, okay, how do we make sure that never happens again? Because personally, you know, I would prefer that we not have to worry about whether or not we have enough healthcare, enough beds, enough of anything to take care of, you know, statistically, this is bad. This is not Black plague, bad. So let's not get to a point where we get to those death tolls. Right. Let's get to a place where we stop things before they happen. Preventative care was an option here that unfortunately we didn't exercise. Maybe we could learn this lesson now and not go through this again.
Well, as I sit here in my apartment in New York City, hearing sirens go by, you know, literally it seems minute after minute, we're in the high point of this crisis, and knowing that, you know, in Chicago, the same thing is going on. I hope that people will get your book. It's called Hood Feminism, but it is about life in America and what we have to do to make it better for everybody. Mikki Kendall, thank you so much for writing it and for sharing your take on our society today. You've been tremendously helpful for us to think forward once we come out of all of this. And thanks to you all for watching us as well. I'm Carol Jenkins. The program is Black America, and we'll see you the next time.